Okay, you're good.
So today I'm going to be giving an intramuscular injection to my patient in the ventral gluteal area. I'm first going to perform hand hygiene. I've already gathered all of my supplies. I have a clean surface and I've arranged my supplies. I'm going to unlock, I did unlock the drawer from the automated system. I'm looking at my med and I'm comparing it to the MAR. I'm going to be giving bilicillin. I have 2.4 million units and it's supplied in 200 million units, so when I did my calculations, I will be giving 1.2 mLs to the patient IM. I'm going to state at this point the rights of patient's right to medication, the right patient, the right time, the right med dose, the right route, the right medication, and reason and response. I'm going to check the expiration date on the med, and it's not expired. It's a brand new bottle. I'm going to document the date, the lot number, and if it was a vaccine, and the manufacturing company on all of my documentation. I've determined the correct needle size for an adult, which is a 1.5-inch needle, 21 to 25 gauge.
Can you just tell me your name and your date of birth?
I'm going to check my medication to my MAR one more time. 8 rights. I return the medication, lock the cart. So now I'm going to make sure that this is my patient, Carlos Caliente, and I'm going to check that against his bracelet and have him state his date of birth and full name if he is verbal. Alright, and now I'm going to prepare my medication. I'm going to clean the top of the vial with alcohol.
So the patient
even though it's a brand new bottle, I'm still going to make sure that I've cleaned it.
I'm going
to catch my needle. I'm going to be giving 1.2 mLs, so I'm going to draw the air back,
I would take my hand,
uncap on the table,
my hand at the bottom of the greater trochanter, the iliac crest, and spread my fingers, and that's where I would be giving the injection. Okay, so I'm first going
pierce
to
the vial,
area from inside out with an
inject my air,
holding the alcohol swab,
and I'm drawing back 1.2
I will then squeeze the muscle
mLs,
and at a 90-degree angle,
avoiding any air
I will
bubbles.
give the injection, holding it at the barrel, and then at the bottom, or the bottom of the barrel, holding my non-dominant hand.
At this point, I would engage the safety on my needle. At this, I have to actually recap in this instance, but I would be doing it on the table if I had to recap. And I'm going to change out my needle. I'm going to get rid of this into my sharps container. And I'm going to put a new needle on the syringe.
So I will then go back over here. I will recap my needle.
I'm going to enter the patient's room with my medication.
I will tell the patient I'll be back.
Patient is on his side. We had put him on his side previously to have the site clear and in view. I'm going to be feeling with the palm of my hand for the greater trochanter of the femur, and also feeling with my fingers for the iliac spine, the iliac crest. And I'm going to spread my fingers here and feel for the muscle. And this is where I'd like to give my injection. I am going to again check my medication, check the patient, and I'm going to let him know what I'm doing. I'm going to clean the site with alcohol.
Hi, Mr. Caliente, how are you feeling? Patient is feeling okay, it's the right response.
And I'm going to hold my swab in my non-dominant hand. I'm going to uncap, bevel up at a 90-degree angle, dart, aspirate for blood, and inject my medication slowly, especially if it's a thicker solution. I'm going to immediately engage safety and hold gentle pressure on the site. I'm going to discard this in the sharps container away from the patient's area. And I'm going to come back to the patient and recheck for any reaction. This is going in the sharps container. I'm then going to come back to make sure that I document my whole procedure appropriately. That would be the final check, right dose, right time, right patient, right medication, right route, right reason.